we just learned that passengers have started to disembark the cruise ship at the center of a hantavirus outbreak. The MV Hondius is anchored at the port of Grenadilla in the Canary Islands. Passengers are being escorted off the ship according to their home country.
So the plan will be that the ship will anchor and that there will be small boats that will take some of the passengers, and it will be done in a very choreographed, coordinated way, in a very protected way. Bring those passengers to shore. There will be a screening that will take place. Right now, there's nobody on board that has any symptoms, including passengers and crew. That's great news.
Centers for Disease Control officials will be there to escort 17 Americans back home. Now, none has symptoms, but they will go to a special facility in Nebraska for monitoring. After that, they will self-monitor for 6 weeks at home. CNN's Melissa Bell is live from the Canary Island of Tenerife. Melissa, good to see you. Tell us what happens next.
So what we've seen over the course of the last couple of hours, Danny, are those very first small boatloads of people being taken off the virus-stricken ship and onto shore. Once on shore, taken onto these buses that are ferrying them on to the airport where their airplanes are waiting for them. The first batch of people to be taken off the ship were Spanish. They are even now making their way onto that flight that will take them onto Madrid, Danny, where they will be taken to a military hospital and kept in quarantine for 7 days, monitored, no visits for them. So whilst this part of the ordeal is over for these passengers, remember that whatever their home country is, there's a whole process ahead of them. In the case of the Spaniards, 7 days in that military hospital, and then there's very long isolation time. The World Health Organization is recommending a 6-week period. So these people, Danny, have been on this ship for more than 5 weeks now. And ever since the virus was first identified in early May, entirely uncertain of their fate, of what their final destination would be, and of how long they were going to be on this ship in these very difficult conditions. In fact, what we heard yesterday was a direct letter from Dr. Tedros, the head of the World Health Organization, to the people of Tenerife, thanking them for their solidarity, for their humanity, and allowing this very complex operation to take place on their island, but also acknowledging the fact that people are afraid ever since the COVID days, and it's normal of these kinds of viruses, but also pointing out that everything was going to be done to ensure their safety. And that's really what we've seen today, a very transparent operation, a very careful operation, and exactly as they'd said, those passengers taken off in small groups by nationality to the shore, onto their planes, and then onward to their next destinations. Danny.
Yeah, you can just tell that the relief, I'm sure, is massive, even as this massive operation is taking place before our eyes. Melissa Bell, thank you so much for that report.
I want to bring in Dr. Scott Miscovich, President and CEO of Premier Medical Group USA, and he joins us live from Kailua, Hawaii. Good to see you again. So last we spoke, the passengers were still on the ship. Now, according to the Spanish authorities, some have been brought to Tenerife. Reassuring news, none of the passengers are symptomatic. That's what we're being told. I want to get your thoughts just on the process that we're seeing unfold before our eyes here.
You know, Kim, as I'm sitting here with you over the past hour and a half listening to this, you know, the thing that comes to mind for me is this is terrific. Why is it terrific? Because the world has learned. We learned from the past pandemic. We're taking all the proper precautions right now. So when I'm hearing the detail of the great reporting we just had from the two ladies, this is exactly what you want to do when you have something where you have a major question. So I'm very pleased to see what they're doing. As we talked about last hour, it's probably overkill because this virus is not COVID. But overall, I'm very pleased that they're all in full PPE, that all the countries are preparing. But I do want to note this, Kim. Where's the U.S.? Where's the CDC? We're just nowhere to be found, which is a concern for Americans because of how much we've dropped out of the world.
Yeah. Well, listen, I was going to ask you some other questions first, but since you just brought this up, I mean, the U.S. pulled out of the WHO earlier this year. Some public health experts are saying that this means that we don't have access to the same surveillance data, contact tracing on this outbreak. On top of that, We have cuts to the CDC. In a case like this, I mean, it may not be for this particular outbreak because of some of the things that we've talked about, but certainly it does bring it to mind. Are we more vulnerable now? Are you worried?
Oh, absolutely. We are more vulnerable as a country than we ever could have been. And also just look who is standing up on top of running these organizations. We don't have medical people. They've cut their budgets, nearly in half. And, the international components of the CDC, we always had a major presence in a lot of the areas where you had all of these zoonotic infections, which is what we're worried about as the population grows. And we could be right there on the front lines with our science, with our expertise. It's gutted. It's gone. And so I think we are vulnerable as a country, and the world is more vulnerable because we're not investing as much. We know how much our budgets have cut. So yeah, I'm very concerned.
All right, well, let's focus on what we're seeing here. We're seeing some of the passengers presumably being taken away now in one of those buses, Spanish passengers, the first to come off the ship. And later, American passengers as well will be repatriated. We know the CDC is sending a team to meet those American passengers. They'll be taken by charter flight back to the U.S. Take us through what happens to those Americans once they're back on American soil.
Well, they're going to be evaluated by medical personnel and hopefully very well-trained infectious disease personnel. They should have a complete evaluation looking for any inch of any respiratory symptoms, which is key with the Andes virus, and any even GI symptoms or fever. And again, they have not announced it, but I'm hoping they are doing the PCR, which we're all familiar with, in the nose, and doing blood tests for the hantavirus IgG and IgM, which will be very definitive of any active infection. But as we've talked about prior, there's usually not asymptomatic carriers of this virus. So then the other thing that concerns me with the loose information we're getting out of Nebraska is they are claiming that if patients are asymptomatic and request to go home, they're sending them home to be on home isolation. We know what that was like during COVID. It didn't work out too well.
Can you just, when we hear, they're being sent to Nebraska, many of our viewers might wonder, why Nebraska? Why a facility there? Can you take us through why they're being taken there specifically?
Well, that is the number one quarantine isolation facility that has been built and prepared for anything like this breaking out, any type of infectious disease or anything that is so crucial that it needs to be isolated. So it's a large facility that can accommodate a significant number of patients and keep it isolated, and has the ventilation where it doesn't leave the building, and it's prepared for this. So that's why Nebraska.
Yeah. We're watching live pictures. We saw moments ago a bus pull away full of people in full PPE. Presumably those were some of the passengers of the ship, and we're just watching some more live pictures of those buses waiting for presumably more passengers. In the meantime, some of the passengers who got off the ship earlier, and I mean before they got to Spain, maybe weeks ago, some of them are hospitalized, I believe, in 6 different countries, from South Africa to Switzerland. How much concern is there for you that this has already spread into the community in a much larger way?
Well, I think I have studied this fairly intensely. All of these individuals, except the one lady that was sitting on the one flight that was transporting an infected woman, all the others were in close contact with the index case. We believe the index case is the gentleman who died from the Netherlands and his wife. And so we really, from what I can tell right now, only have one person outside the ship. And then if you think about the fact we had 147 individuals on that ship, and when you counted the extra staff, et cetera, almost 200 individuals, and then we only had 7 people infected, that also tells you that they had to have very close contact, because that 7 out of that number is not a very high percentage compared to when we had COVID. Half the ship would walk away infected. So what we do know about this virus is that particle has to get very deep inside the lungs and find receptors deep in the lungs. So that's why it's believed this is truly really close contact with a large amount of secretions that are infected to spread. So it's not going to be just this random walking by 15-second exposure that could give people COVID. It has to be very close contact and prolonged contact.
Joining me now is Dr. H. Dele Davies. He works at the Nebraska facility where the American passengers will eventually go for monitoring. Doctor, thank you so much for joining us on such a busy and consequential morning for this story. Let's set this up, though. Tell us about this specific facility and what it is used for when it comes to cases like this.
So we have the only nationally designated monitoring center. And this is a 20-room unit that looks pretty much like a hotel room. However, it's specially designed with what we call negative pressure rooms, so that any kind of deadly disease is kept inside the room. And then we have specially engineered controls so that any air that leaves the room is filtered through high efficiency particulate air filtration. And then the rooms themselves, because we expect that people may have to stay there for prolonged periods of time, I like a hotel room, actually more than a hotel room, because in the rooms we have equipment where the people living there can have do exercises. They have a room service there to help them have the activities of daily living. They have monitors, Wi-Fi, so they can communicate with their families. So this particular setup is really, if our federal partners determine that they would like any of those passengers to stay, that they can be as comfortable as possible.
Wow, that's truly remarkable. Can you tell us a little bit more, Doctor, about what patients can expect once they actually arrive at the facility? How are they going to be processed? And is the protocol perhaps any different, considering at the moment they're all asymptomatic?
Right. So these, we'll call them passengers since they don't have any symptoms, as you've pointed out. What they would expect is that we would welcome them. Obviously, we're delighted to have our fellow American citizens back home, as you've pointed out. We would then work with our federal partners, with the CDC and others. We would check to make sure that none of them have any of the symptoms that we would be concerned about, like fever, muscle aches, it's often headaches, maybe some GI symptoms like stomach pain, diarrhea, etc. Those are some of the early stages of things that you'd expect with hantavirus. And later on, of course, when they get more sick is when they get the difficulty with coughing and breathing and fluid in their lungs, and ultimately have low blood pressure. So we would just basically assess them, and then our federal partners will make the determination of which ones stay here in our special monitoring unit, and those that they consider they would like to sort of send closer to home. If for whatever reason they do stay here, we have highly specialized personnel, interdisciplinary teams, doctors, nurses, physical therapists, all kinds of interdisciplinary workers ready to handle them. And if any one of them does turn sick, we have a biocontainment unit where we've handled patients with Ebola and COVID in the past successfully. So we feel very comfortable and confident that we'll be ready to take care of our fellow citizens right here.
Wow. Doctor, once you are able to release some of these people back to their homes, can you give a sense of what home monitoring might actually look like, and what will happen to these people if they do start to exhibit symptoms?
Well, so that determination to release them to their homes will be most likely made by our federal partners, the CDC. And if they do make those determinations, then they would be monitored the same way that I just described. They will be asked to check their temperature. They'll be asked to monitor for all the signs of muscle aches and GI symptoms. They'll be asked to, obviously, if they have any of those symptoms, to seek help immediately. And then the ideal scenario, depending on the perceived risk upon the time they arrive in terms of their contact with somebody who may have had the disease, is you'd probably want them close to a place where they could be quickly cared for. So, those who may be farther away from a specialized unit than us may be held closer to those units, and those who are closer may be allowed to stay home, and then, knowing that they can get that care fairly quickly.
Doctor, what do you see right now as the risk to the general public as these Americans are set to head back to the States?
Well, I would say that the risk is low, Danny, because unlike Ebola or COVID, the Andes virus is one that is not easy to get. You have to be in fairly close contact with someone who has developed the symptoms, not somebody who's well, but somebody who's developed the symptoms. And so the risk of actually transmission is low. If you do get it, then the disease itself can be very highly deadly, but it's not one that we generally worry about in terms of transmission to the general public. So for those people who are in contact with somebody who's well, generally the risk is low. And most of these people, as you know, are coming off a boat where there were over 150 people. And to our knowledge, I believe about 7 have been sick. So the risk of transmission itself is low. Obviously, the risk of the disease is significant. So the general public should feel very safe.